The team at Rehab Innovations is excited to introduce the revolutionary Upper Extremity Ranger. The UE Ranger is a rehabilitation tool therapists can use to resolve their patients' sources of pain and movement disorders with supportive healing motions. Restoring the health to upper extremity motions, the functional needs of our patients, and within the confines of today's healthcare can be a challenging process for everyone. Because of the UE Ranger's unique design, your patients can see measurable improvements with injuries to upper extremities faster than ever. You'll be able to help your patients decrease pain, improve range of motion, build strength, and increase endurance. Our innovative tool is simple to use and takes a revolutionary approach to restoring coordinated movement patterns. The UE Ranger is an assistive motion device designed to support graded progressions of motor activity into multi-plane biomechanics. Independent research has shown the UE Ranger's ability to safely provide a balance between the necessary support of the passive phase of a patient's motion recovery and the challenge requirements associated with active assistive progressions. Rehab Innovations has developed the UE Ranger to simplify the complex process of restoring movement health. Let's take a look at how it works.
Hi, my name is Dan Miller. Today I would like to share with you how my experiences both as a physical therapist and as a patient have led me to develop the Upper Extremity Ranger Movement Health System. My goal is to explain and demonstrate why I believe the UE Ranger can provide much more effective support of your efforts to restore your patient's movement health than anything you've used before. Before we start, you need to know that I am not alone in my belief that the UE Ranger Movement Health System is a powerful tool. Independent research studies and clinical trials have continued to prove that in ways never before possible, the UE Ranger can most efficiently support the natural processes associated with both tissue healing and restoring functional movement capacities. Today we're going to show you 3 examples of the UE Ranger's capacity to facilitate the body's healing and movement reintegration processes. Part 1 will focus on the passive phase of motion recovery. Parts 2 and 3 will demonstrate how therapists can use the UE Ranger in the active assistive phase with both neuromotor re-education and strengthening and endurance training.
Before we begin the demonstration, let's lay some groundwork. As you know, the nervous system is the most influential component in our attempts to help patients restore normal, pain-free movement. Prior to any movement, the influence of the nervous system must be recognized by ensuring that the patient feels secure and is unapprehensive at rest. This is accomplished by adjusting the UE Ranger and securing strap to comfortably support the patient's involved upper extremity, identical to that of their post-operative sling. A vital capacity of the Upper Extremity Ranger, beginning in this phase of recovery, is the ability to naturally gate or relieve a patient's pain and related history of guarded muscle tone. This is achieved by reorganizing the communications between the abnormal resting tone, associated with fear, pain avoidances, and motor inhibition with the voluntary productions of passive motions that are meaningful and that help the patient relax. This new message within the neuromuscular system enables a disassociation of the previously bound glenohumeral joint, thus restoring a patient's awareness to recognize freedom of movement, potentially for the first time since the onset of their pain or injury. This capacity to disassociate, as demonstrated by this anatomical model, is the key for the protective guard to be relaxed, thus opening a window of opportunity for true healing to begin.
Our bodies are designed to move and need to in the natural course of healing. Producing these subtle freeing movements post-operatively, or also in the case of restoring chronic pain histories, has shown to generate safe accelerations in both resolving pain and restoring the health to movement production.
As Dan works with his patient, notice how the UE Ranger helps support the process. The patient, free from apprehension, is willing and able to produce passive, varying planes of movement. In combination with the therapist being better equipped to monitor and teach the complexities associated with motor tone and biomechanics. During this form of passive movement recovery, it has been theorized that the ability to reduce pain and balance motor tone is related to the UE Ranger's ability to down-regulate the autonomic nervous system's guard by calming both the pre-surgical protection state and the post-surgical response to the procedure. Next, the UE Ranger facilitates type 3 mechanoreceptors, which overrides the nociceptors associated with tone imbalances, inflammation, and swelling. The UE Ranger supported motions also increases the capacity of oxygenated blood reaching the site of healing tissue and carrying off metabolic toxins. Prior to progressing beyond this phase of movement reintroduction, consider the functional limitations and potential negative consequences associated with traditional pendulums and forward bows. Persons with lower back pain or orthostatic hypotension are likely to be fearful and physiologically on guard and therefore unable to relax and thus potentially complete the effort with an aggravated spine and a reflexively guarded shoulder. Encourage your patients as they become comfortable and competent with the level of supported intervention and gain the capacity to self-quiet the guarded and painful shoulder to arrive 15 minutes before their scheduled appointment and warm up with the UE Ranger. This provides you and the patient a supple joint system with which to deliver your knowledge and manual skills instead of spending 10 to 15 minutes getting them to relax. Following your manual interventions to gain passive range of motion and prior to your cryotherapies, ask your patient to resume this phase of UE Ranger applications utilizing 10 to 12 repetitions within the motion you have gained. This reestablishes this new range within the brain's perception as a healing intervention.
As you transition your patient into the active assistive phase of motion recovery, we know that it's not an all or nothing transformation. Instead, the progression includes two concurrent components: a gradual transition period, ensuring the lessons learned and gains made in phase 1 remain influential and ensure success during the active assistive phase, and the new capacities required within the progression of movement are capable of responding favorably to the graded loads and reflexive nature of coordinating functional movement patterns.
Maintaining a balanced resting tone and generating coordinated force productions are two principal components of successful progression in the active assistive phase of motion recovery. Frequently, when working with patients dealing with chronic pain or who are recovering from surgery, portions of the rotator cuff exist in an inhibited state, which makes it difficult to fulfill its role as a stabilizer or a force couple. The UE Ranger solves this problem. For the first time, a patient is empowered to naturally facilitate isolated neuromotor re-education activity of previously inhibited muscles. How? The UE Ranger revolutionizes this process by merging the capacity of producing normally facilitating actions of the muscle joint movement system with the underlying foundational balances of motor tone, joint freedoms, and kinetic chain support. As Dan demonstrates with his patient, in this case with the abbreviated empty can motion eliciting a ramping up of the motor units of the supraspinatus muscle. Notice as Dan monitors any unattended amplifications of the upper trapezius muscle. Progressive recovery of this muscle system facilitates the recovery of a balanced neuromuscular state within the broader shoulder girdle, leading to the recovery of healthy biomechanics through the full kinetic chain. Related to this example of progressive recovery, the UE Ranger helps facilitate the full involvement of the serratus anterior muscle, which serves to anchor force productions of the rotator cuff while directly producing scapular contributions to movement progressions. Notice as Dan monitors any unattended amplifications of the anterior deltoid muscle. The result? The patient can confidently integrate this new motor activity into a meaningful active assisted sequence of variable movements, which leads to consistent improvement through subsequent therapy sessions. As you can see, the treating therapist can monitor both visually and with palpation the potential of a deconditioned joint system has to revert back to compensatory patterns. With this information, Dan can consistently reinforce the lessons for his patients to recognize a balance within movement productions and to know when to stop an exercise set because of the onset of a fatigue or pain-related substitution patterns.
The next phase is helping the patient progress from the clinical exercises into real-life activities with the focus on strength and endurance training. Naturally, we want to preserve the progress we've already gained while preparing the patient to adapt to the new capacities that will be required. We know that the first level of strengthening impaired tissues is getting the right messages to the right muscles with the right intensities. My experience has been that with traditional methods which require the action of gripping, the involved hand actually limit rather than facilitate this phase of strengthening and therefore make all related progress more difficult. Let's see if you agree. I'd like you to do this exercise with me. Let me ask you with either of your hands to create a grip with your wrist slightly extended and with only a moderate force. As you create this grip, observe the muscle action produced at your shoulder, stopping and holding at the point you feel your shoulder muscles begin to tighten. Maintaining this wrist position, elevate the arm to a point that you not only feel the effort to move against gravity, but also observe the effort it takes to move against your self-produced impedances created by the gripped wrist and hand alignments. Mentally note at the height at which this occurred. Now relax the muscles of your full arm and allow your hand to open. Repeat this same motion with your now relaxed upper extremity and recognize both the reduced load, the ease of movement between the multiple joints along the kinetic chain, and the distance you move compared to the previous example. Now put yourself in the body of a post-operative patient within the active assistive stage of motion recovery. Asking a patient to support their recovery efforts with the requirements of a grip produces the likelihood of two potentially disruptive responses of restoring coordinated movement patterns. Here's the first. Remember that a grip is a distal action that requires a proximal stabilizing response to occur. You felt this response in the act of gripping. This is normal. However, with a weakened postoperative rotator cuff, research has shown that grading the recovery of force production from smaller motor units to larger ensures that the proper strengthening progressions, absent the commonly produced compensations, such as those evident by the hiking of the shoulder. Second, we know that gripping requires a co-contraction to be produced by the agonist-antagonist relations along the forearm and distal upper extremity. This force activity naturally impedes the accessory motions required of a fluid transition along the kinetic chain as movement progresses. Try it again on your own. Recognize with a gripped hand the difficulty of flowing smoothly if you are unable to pronate and supinate your forearm, extend and flex your wrist, and properly rotate your shoulder without impinging. As you can see, the UE Ranger offers a positive alternative to all interventions requiring a gripped hand. Yet based on clinical responses and related research, we recommend that supporting motions within these versions of both open and closed chain exercises should be delayed until the latter stages of the active assistive phase of motion recovery. Instead, based on that same clinical experience and relevant research, we begin by utilizing the preloading of the glenohumeral joint prior to and with movement progressions that more effectively support a graded progression of motor unit recruitment. We've discovered that this approach is more likely to facilitate a proper balance of the dynamic communications required for reaching a specific training interval while reestablishing the strength and endurances of new and healthy motor patterns.
Let's take a look at this patient as an example. She is currently capable of elevating her shoulder to 90 degrees before her strength and endurance-related deficiencies give way to compensatory efforts. Utilizing the movement health system with the appropriate setup and preloading instructions has shown a consistent capacity for patients to successfully execute 8 to 12 repetitions free of compensations, thus reinforcing the promotion of true movement health recovery. If there is recognition that the patient is creating movements inappropriately, such as failing to externally rotate the humerus at heights above 70 degrees, or there is evidence of the scapula, clavicle, or ribs supporting any impedance to movement, the therapist's hands are free to mobilize and facilitate while the patient is integrating this information into their movement executions. Let's consider one more area where the UE Ranger can benefit your patients. As we've all been taught through our study of movement science principles, the body's full kinetic chain is integral in supporting both the creation and execution of coordinated movement patterns related to daily tasks as well as athletic performance. As an example, reaching for an object on a higher shelf ideally occurs from the ground up. So incorporating the lower extremity, and specifically hip extension and dynamic core support, can greatly accelerate the recovery of normal, healthy, pain-free movement. As you can see, the UE Ranger supports your focus on the entire kinetic chain, allowing you to implement the entire range of your knowledge and therapeutic skills to restore movement health.
We hope you see why we're so excited to introduce the UE Ranger Movement Health System. Many therapists and patients have been overwhelmingly impressed with the difference it makes in their movement recovery progress.
We invite you to visit our website at ueranger.com, where you can find further resources to support using the UE Ranger with your patients. You'll be able to download a clinical manual and home exercise program, as well as view the supporting research and testimonials of both professionals and patients. We'd be happy to answer any questions you might have or discuss in more detail the features of the UE Ranger Movement Health System. Please call us at 402-210-8406 or email us at rehabinnovations@cox.net. We look forward to showing you how powerful the UE Ranger can be for your patients and your practice.